So there is no health without mental health. So for me, that's very important. So these days, these celebrations are very important because it increases awareness and at the same time decreases stigma. That people would be able to go to their specialist without any hesitation and they would be able to get well and would increase their quality of lives. So that is very important. This is in the context of an anxiety because of course shortness of breath can appear in other medical conditions, could appear when you have heart problems, when you have pulmonary concerns, but this is in the context of an anxiety. The thing about anxiety disorders is that symptoms will come out physically. So isa yon, difficulty breathing, or you have rapid short breaths, minsan chest heaviness, there is a lump in your throat, you feel hindi ka makalunok, hindi ka makahinga. So these are important things to consider in an anxiety disorder. So one of it is that, the breathing becomes difficult or the breathing becomes rapid. Bumibilis ang paghinga. So usually when that happens, it causes some temporary imbalances inside of the body that biglang maninigas ka, or you could get cold, clammy extremities. So what we do is that, of course, we actually tell our patients to practice deep breathing. You deep in, you inhale very, very slowly, and then you exhale also very slowly. Another thing that's also very helpful is that you breathe in and out into a brown bag. Kahit anong bag, yung brown na supot, you breathe in and out through that so that it can regularize your breathing. So those are very important tips. Of course, the thing here is that is happening for a reason. Anxiety is happening for a reason. So very important that we get to the bottom of it. So please, seek help, professional help, so that that person or that doctor can help you with your anxiety. When you're feeling overwhelmed, for me, very important is that you stop what you're doing at that particular time. You take a breather, 15 minutes, you might want to get some coffee, you might want to go for a walk, anything to distract yourself. You may want to listen to some music, you may want to watch a short funny clip on YouTube and everything in order to get yourself away from those thoughts that overwhelm you. Then afterwards, you can go back to it with a clear mindset, with a thing that actually you're already relaxed, and then go on and continue doing what you're doing. But it's very important at that particular point that you're starting to get overwhelmed or you're feeling overwhelmed, you need to stop. You need to take a break. It's like vuelo. You try to reset yourself, and then after 15-20 minutes after that break, then you go back and start doing things all over again. So it actually also would be able to stop you, because when you're feeling overwhelmed, suddenly it's like you can't do anything anymore. You're paralyzed. Sometimes you're paralyzed with fear. Oh my God, it's already 2 a.m. I haven't started anything. The deadline is already this morning. So you end up not doing anything. So maybe those are important things. You need to take a break, and you need to also have some sort of like a routine to follow so that it gets you out of the feeling of being overwhelmed. If you have a routine, so that usually kasi right now we are very fast-paced, Usually the job or our work or our studies is actually our vertebrae, the center of our universe, and then everything just revolves around it. But if you're able to structure it in a different way, wherein you have a routine at 8 a.m., you eat your breakfast, at 9 a.m., you read, you start preparing for work and so forth and so on, and then by 4 or 5 p.m., then you stop working and then you focus on yourself. So that is a routine. It means that work is just one of those things that you need to do to accomplish in the day. Unlike if work is your backbone and then everything evolves around work, so you might start work at around 8 a.m. and then end up at around 10 p.m. And then those are the things that then your life just starts to revolve around work. You're not able to take care of yourself, and self-care is very important. You are ensuring by means of a routine, that you have something you have something for yourself. You need to do something for yourself. Unlike if you don't have a routine, then it's just up to whatever happens. And then by the time you realize it's already midnight and you haven't done anything for yourself, you haven't even relaxed, and it's time to sleep, you haven't eaten your dinner yet. So very important that you have a routine. Why? Because it depends upon the reason why you're crying at night. Okay, so there are different reasons why you're crying. Are you crying because you're panicking? Because the next day it's already your deadline and you haven't done anything yet? Are you crying because you're so depressed, something bad happened to you? Are you crying because there was a traumatic experience that happened to you? Are you crying because a loved one died? So it's very difficult, okay? But the mere fact that you're crying at night, it's telling me that something's not right. So best if you could consult a professional with regards to that. Again, could be a psychologist, could be a psychiatrist, could be a psychiatric nurse, as long as there's someone that would guide you and you guys can process it where the reason for the crying at night is coming from. For me, very specific. Please consult as a professional, preferably a psychiatrist or psychologist with experience on trauma-based therapy. Very particular when it comes to patients coming to me, like for example with post-traumatic stress disorder, acute stress disorder. Usually I refer to my colleagues who has training on trauma-based therapy, because it's like Pandora's box. Once we open the trauma, then we really don't know what's there, and it might be very difficult to close that box again. So I'd rather that a person with expertise on trauma therapy be the one to handle your cases. Before, we would say that it has to be a particular traumatic experience. Either you experience it to yourself, like for example, sexual trauma, sexual abuse, or you witness it happening to another person, maybe a murder, that kind of thing. But recent studies have shown that might not just be one big trauma, but trauma that's happening regularly to you. So that could be considered traumatic in itself. Like for example, if you're having flashbacks, you're having nightmares, or anything that reminds you of that event, you avoid. You suddenly cry out of nowhere, or you would have blank stares. So those kinds of things. You're not able to sleep at night. You're very hyper vigilant. A mere sound or a mere bang, you're easily startled. So those kinds of things would actually is pointing us towards trauma. So those are very important things. That's a very good question. Yeah. So those things actually are pointing towards the criteria of a major depressive disorder. Please consult a professional for that. You might need medications for it. I'm not saying that you will, but you have to consider it. If it's a major depression and functioning is already affected, you're not able to relate anymore. You're just in your room. You don't want to talk to people. You're absent all the time. Your grades are failing. You're so irritable. So it's already a disorder because your functioning is already affected. So if that is the case, your concentration is also affected. So there are some, not some, but it's very common. They would say, can I just go for talking sessions or psychotherapy? I don't want to take medications. So that's usually the thing. The problem here is that in depression, your concentration is affected. So once your concentration is affected, it will be very difficult to focus during therapy. So during talking sessions, because when you go on for talking sessions, you need to be there. You need to understand what the therapist is telling you. If you're so depressed that you're not able to concentrate, so the therapy is in a way useless. So you might benefit from being started on a medication, then the concentration improves after 2 or 3 weeks, and then go for talking sessions. Actually, scientific literature has shown that the best combination in the treatment of major depression and generalized anxiety disorder is both medications and talking sessions simultaneously. So please consider it if really the functioning is already affected. Well, usually it's you're given a golden opportunity And then you suddenly would self-sabotage in a way na maybe it's not for me, maybe it's too difficult, maybe I won't be able to do it. There are others naman who are you're more competent and more qualified than me, sige sila na lang. So that in a way is self-sabotage, you have a chance. So me, when it's like that, the thing that I ask immediately my patients is that if you go through it, what is the worst thing that could happen? The worst thing that could happen is that you find out that, hey, maybe this is not for you. Maybe this job is really not for me. It's meant for others. Maybe I'm better suited for another position. That's the worst thing that could happen to you. But you won't know it unless you go through it. And then there's the flip side. What if you are for it? What if you enjoy it? Those are the things that when we say self-sabotage, you are doubting yourself. There is self-doubt. So for me, in order to deal with it, nobody can deal with it except you. The thing is, you need to go through it so that you will find out for yourself. Because if you don't, then it will always be a what if. What if I went through with it? What if I said I wanted to go through it? What if, So the only way to get rid of that what if you go through the experience yourself and find out for yourself, you will have the answers. When they're really serious about it, they won't even talk about it. They won't even say anything. But you would see subtle signs, okay? One of the subtle signs will be they're not able to sleep. Another will be they're irritable. So any changes in their behavior could be because in literature up until now, we have suicidologists in the States. They study all about suicide. We really don't have any predictor of suicide. What I mean here is that if I see this, then this patient will attempt suicide. We really don't have that. The best predictor of a suicide attempt is a previous history of a suicide attempt. That's it. Others we don't have. It's like, what if my mom, there is a family history of suicide and everything. There is no direct predictor of a suicide attempt. Okay, but again, as I've said, there are subtle changes. With Ron, they've always with the family. Now doesn't want to even interact with the family. Before, sleep was okay, but now sleep is erratic. He's awake. He or she is awake at 2 or 3 in the morning. Before, very kind, gentle and everything. Now, very irritable. Then, before, very calm. Now, very restless, very agitated. Would move from one thing to another. Might not be telling us that the patient is suicidal, but these are changes in the person's behavior that may lead into suicide. So please take note of that. They might not be very verbose, especially those that are really serious. They're thinking about it, they're planning it. Of course, they won't tell it. They won't tell the family members. So please be aware of any changes in the behavior from normal of your loved ones. In psychiatry, we consider suicide as a psychiatric emergency. So please bring to the emergency room as soon as possible, immediately, so that they would be evaluated. The psychiatrist will be able to evaluate and make sure that your loved one is safe. Another, of course, we have treatment options at MakatiMed. We have medications. It's a nasal spray, that actually helps deal with immediate suicidal intent or suicidal behaviors within 2 hours. So we have options that are like that. Even if they're saying it, sinasabi lang niya yan, di gagawin yan. Paano kung gawin? Or they will say, hindi, akala namin hindi seryoso eh. What if siya sa sarili niya, na miscalculate niya, then it became lethal or very serious. So even with that, we don't know what's going on in their head. So please bring to the hospital so that they can be evaluated by a professional, a mental health care, professional, a psychiatrist, a doctor, so that we would be able to see and for ourselves how the patient is. Rather than just, play it by ear, I would rather that the patients are safe. So I'd rather that they be evaluated by a mental health professional at that particular time, immediately. There is hope You know, having a mental health condition is not a death sentence, especially in Makati Medical Center. We are here. We have the Department of Psychiatry. I am the director of the Mood and Anxiety Resource and Referral Center. So we have a lot of tools, a lot of treatment options for you. So there is always hope. So again, there is no health without mental health, and we are here to make sure, or at least be there, be supportive, be advocates of your mental health. So thank you.